Hi, my name is Melita and I'm your student nurse today. Could you state your full name and date of birth for me, please? And I'll check your wristband at the same time.
Sheila Van Omeren, 5388.
Okay, thank you. And do you know where you are?
In the hospital.
And do you know what day it is today?
April 1st.
Okay. And do you know the President of the United States?
Donald Trump.
All right. Well, I just checked. The patient is awake, alert, and oriented ×4. And I'm going to do a head-to-toe assessment. Is that okay with you?
Yes, please.
All right. So I'm going to provide privacy. And I'm going to wash my hands. And I'm going to put on my gloves. And we'll start out with your hair. And I'm going to check for any lesions, lumps, and infestations in her hair. Everything looks fine. And I'm gonna inspect if her body type is correct for her height, weight, and age. She looks groomed well, and her skin color looks good for her ethnicity. Let's see what was. I'm gonna check her eyes. First, I'm gonna just looking at her. I can see that her eyes are symmetric and round. I'm gonna check for her conjunctiva on both sides, if they're clean, clear, and pink, which they are, and her sclera are nice and white. I'm going to have you look at my nose, and I'm going to see if your pupils are reacting to light. So I'll have you look at my nose. And they react to light bilaterally fine. I'm gonna have you tilt your head back so I can look in your nose and check and see it's nice, moist, and pink. And if you can, and I'm also gonna check in some of your cranial nerves by having you look at the light when I move it up and down. So I have you look at my nose again, and I want you to follow my pen. So I'm gonna move it, and you just follow it. And her eyes are following my pen correctly. I'm gonna check in your mouth. I'm gonna check for any abnormal swelling of the gums, of the tongue. If you can open your mouth for me, please, and hold up a little back. Say ah. All right. And I'm checking for any broken teeth. Everything looks fine. No broken teeth. And her mucous membranes look nice, moist, and pink. We're going to, I'm going to check your range of motion for your spine by having you look up and down, and to the left and the right. Okay? And I'm also going to check her aortic pulse on both sides. Okay. Got a strong pulse, and I'm going to also check that the jugular vein is not extended. So if you could look that way for me, and it's not extended, so look the other side. Same thing, it's not extended. And I'm gonna check for her skin turgor by pinching right here. and her skin is not tinting, so she's nicely hydrated. Next, I'm going to check for your lung sounds, and we'll start on the posterior first. So I'm having 6 areas that I'm going to be listening to, and when I start, I'll just want you to take a deep breath for me. You can lift up your arm for me. On the other side. All right, and her lung sounds are clear. I don't hear any crackles or wheezing. I'm going to have you move around so I can do the same thing on the back. If you can take a deep breath for me when I start. Okay, sounds good. No crackles, no wheezing. And you can turn around for me. I'm going to check your radial pulse. Her radial pulse is equal and strong. And I'll check your hands and your capillary refill is less than 3 seconds, and skin looks nice and dry, and there's no cubbing on her nails, and her nail bed is nice and pink. And I'm gonna have you do some range of motions with your arms. If you could just move your arms up and down, okay? And then I want to do the grip, and I want you to pull, and I want you to push. And her grip is nice and strong. I'm going to check your heart right now, and you could just breathe normally. And if you can lift your arm up for me. Her heart sounds are fine. I don't hear any irregular heart sounds. And I'm gonna listen for 1 minute at your apical heart rate, your pulse, apical pulse. So if you could lift up your arm one more time. Okay, I listened to her apical pulse, and her apical pulse is 70, which is in normal range. And I forgot to take your vital signs, so I'm going to do that right now. Okay, I'm going to take your blood pressure. If you can move your hands up, lay it down. Thank you. And do you know what your usual blood pressure is?
No, it's usually low.
Okay. And her heart rate, her blood pressure is 110/70, which is in normal range. Next, I'm gonna listen to your, or check your abdomen, and I'm going to listen to your bowel sounds. So if you could move backwards and lay down for me. And we'll see if we can still, yeah, we can still see it. So first I'm going to check her skin and check for any lesions, scarring. Everything looks fine. I'm going to lift up your shirt for just a little bit. And I'm going to listen to the, I'm going to listen to your aorta, abdominal aorta, and then I'm gonna listen to your bowel sounds in all four quadrants. And I do the auscultation first because I don't want to palpate and disrupt any bowel sounds. Okay, the pulse sounds nice and strong. I'm going to listen for 15 seconds in each quadrant. Okay, she has active bowel sounds, and I counted a total of 112 bowel sounds. And let me put your shirt back. And before I forget, did you, when was your last bowel movement?
30 minutes ago.
Okay. And do you have any discomfort at this time as far as your scale of 0 to 10? Any pain?
No.
No. Okay. So now I'm going to palpate your stomach, and it's kind of uncomfortable, but so I'm going starting the same lower quadrant. And I'm trying to feel any abnormal swelling or tenderness. Do you have any tenderness when I palpate? Okay. So the patient stated no pain, no tenderness at palpation. And I'm going to inspect her feet. And I'm going to take your socks out real quick. I'm going to check for skin color, and I'm going to check her capillary refill on her toes. And since she has nail polish, I'll do it on the bottom of her toes. And her capillary refill is less than 3 seconds. I'm going to check her pedal pulse. And her pedal pulse is equal and strong. And her tibia pulse and her tibial pulse is also equal and strong. Now I'm going to check your legs for any kind of edema. No edema noted. Skin looks nice and dry and good skin color. And let's see, you can sit up for me. And yeah, go ahead. And then there's one more thing that I want to check is your range of motion with your legs. If you could pull up one leg and then the next one, okay? And I want you to push your foot against me and push it down and wiggle your toes. The patient has good range of motion for the lower extremities. And there's one more thing that I forgot, and that was I was supposed to take your temperature. So when I take the vital signs, I take the patient's temperature, and I'll ask the patient if she had anything to eat or drink in the last 30 minutes before I take her temperature. And then I'll check and see if her temperature is in normal range. And that concludes the video. All right, thank you.